2. Welcome. I'm going to give it a few minutes. Let everybody get on. We're going to see who went ahead and put those notifications on. Who did it? Let's see. 1, 2, 3. All right. How y'all doing? Talk to me in the comments if y'all here. I'm going to give it a few minutes, let people trickle in. And then I'm going to get started because we covering chapters 3 and chapters 4 today. And I was able to get my notes to where I can show them on the screen. So I will be doing that for you all today. You will notice that my instructor notes are there for myself because I'm just sharing the notes that I make for myself. So don't mind me. When it says remind them and I say, guys, don't forget. All right, I see 4 of you. I know last week we had 5, so I'm going to give it just another second. And then we're going to get started. I would love to know who is here. Just say hello in the chat. From my screen, I can't see you guys where you are. But if you talk to me. I can. All right. And then I also prepared a little quiz. I know I said I wasn't, but then I was like, that doesn't make sense. I want to make sure I'm checking in with you guys on your knowledge, that I'm not just blowing past information. So I thought I'd do that. Maybe we'll get into it next week. We'll go over everything today. I also know that there's a few folks that are either buying books this weekend or waiting for books to come in. All the videos will be available on YouTube. As soon as I finish, they're recorded in the live section. Hi, Letitia. Did I say that right? Miss Lyons. So those will be there for you. So if you're waiting on books, that's okay. You'll still be able to go back and rewatch lectures if you need them, okay? And you'll quickly notice I'm just reviewing the chapter text. So barring you guys having specific questions, you really should be okay to jump into this whenever you want. And the beauty of what we're doing is once we're all done, this class will be available online to anybody that needs to access it. So I'm excited about that. Hello, Just Tiff. All right. I don't want to wait too long because we do only have an hour together. As you guys know, on Monday nights, I have a class right after you guys finish. I'm taking a market manager certification course, which will prepare me to be able to host farmers markets in the state of Illinois. And then on Wednesday nights, I have QA. So I do have a little bit more time tonight than I do on Monday night. So if I need to hang out, I can. And just so you guys always know that I do have more time to hang out over if you guys need me on Wednesday nights versus Monday. I have 15 minutes and then I got to hop right into another Zoom. So, okay. So last week we covered a look. Hi, welcome. I'm Alessandra Nicholson. I'll be your instructor. This is class 2 of our Sterile Processing 101 free certification prep course in honor of Hillman Talk and Black History Month. This will be covering chapters 3 and 4 of the HSPA technical manual, which let me get mine out of my bag so that we are prepared. All right, now we get into it. Okay, we get into it. And look, it ain't missed on me either that it's all Black women that's trying to get themselves some free education and step into a new career. Whew, it is not missed on me. And it makes me even more excited because I'm just, in my mind, I'm already ready for y'all testimonials when we finally get you guys into sterile processing positions and we get your income up and we get you out here in a new career. Okay, so we are going over chapters 3 and 4 For chapters 1 and 2, chapter 1 was an introduction to sterile processing. So we did just an overview of the department. I talked to you guys a little bit about some of the governing bodies that give us our rules. I talked to you a lot about infections and hospital-acquired infections, to be specific, which is going to be what you guys are there to prevent. Well, I see a question. Just Tiff says, question, is the book on sale anywhere by chance? Yes. So if you go, let me see if I can put it in the chat. If you go to myhspa.org, you will be able to find the textbook for sale there. I highly recommend, they have a box set that includes a textbook, and then it also comes with a workbook, and the workbook has quizzes and tests in there for you to self-test yourself, okay? You will notice when you go onto the website that I have the 8th edition. You will be buying the 9th edition. It just came out last year. Mind you, I've had these since I was a wee baby tech back in like 2010, something like that. Okay, they just updated it last year, so you would have the 9th edition. It's not dramatically different, it's just updated. So you should be able to follow along regardless of which set you purchase. I do feel like I should tell you, HSPA is a governing body that gives us our certification. They have no affiliation with the Candray Institute. I do not receive any funds if you guys go on there and buy books, okay? But I do recommend that you get it if you really want to take this test, okay? If you just want to try to sit in here and get an overview, you'll be all right. But the problem is you're not going to have that vocabulary, and the vocabulary is really what's going to take you over the line with the exam, okay? And then last little thing, since I am talking about the book, I just want to remind you guys, I'm going to say it 1,000 times within this class, get you some flashcards, okay? Whether it is going to like a dollar store, Dollar Tree, something like that, and getting you the index cards, or if you want to use something online, if you can find a free something, feel free to use that. I'm personally a very kinetic learner. I need to put my pen to my paper, but however you do it. But I do recommend you do it, and I do recommend that as you are reading your chapters, you're making your flashcards, and you keep those in your purse with you, and you flip them all the time. Okay, when you sitting there and you've been on Facebook for 3 hours or TikTok for 4 hours, scrolling, put it down. Get them flashcards out. Start reviewing. Because what you will notice is you will pick up this terminology much, much faster, and you will be so much more prepared for the exams, okay? All right. So let's see. I got to get these lecture notes up on the screen. All right. Let me know in the chat if you guys can see that. I tried to make the font as big as I feel like I could without it like being overwhelming, but yes. All right, and then I'm looking at a separate page to read my notes because this is too small for me. Okay, so if you notice that I need to change the page, yell at me, okay? All right, so we're going over chapter 3. If you can tell me in the chat, did you do the reading for chapter 3 and chapter 4 already? Did you do the reading for chapter 3 and chapter 4 already, or are you holding off for some reason that I don't understand? It would be very much my recommendation to you guys to read these chapters before the class session. It will also require you to really pay attention to that over your weekend because we have class Monday and Wednesday. So there's no way you're going to read let me not say no way. Maybe you're a speed reader. Highly unlikely that you're going to read for comprehension between Monday and Wednesday, these 2 chapters, okay? So between Thursday and Monday, really have a solid plan for yourself on how you're going to do your reading for the 4 chapters for that week, okay? Because when you're live with me, I want you guys to be asking me questions about what you didn't understand in the reading versus listening to me lecture and then go read and be like, I don't know what she was talking about on chapter 1, and now she on chapter 5, okay? Does that make sense? Give me a thumbs up or something, okay, if that makes sense. I see one says yes. Okay, beautiful. Okay, so chapter 3 is anatomy for central service technicians. We're going to talk about human anatomy. You can think about it as like a college anatomy and physiology 101. The purpose of this is to give you a background into the functions of the body's systems You're going to hear me talk about the body itself as a system, and then I'm going to talk about the individual functions of the body as systems. And as we go through this work, we're learning that so that we can then match those bodily systems and bodily conditions with surgical procedures and surgical instrumentation. Okay. So the definition of anatomy, the study of the structure and function of the human body. And I just talked about this. It's important to you guys to understand it so that you can identify instruments. If your OR surgeon was to call down and say, I'm having a cabbage right now, how many people in the chat know what I'm talking about? Right? But if you read through chapter 2, you know that a cabbage is associated with the cardiac body system. And that's going to, as we learn, tell you about what surgical instruments to go and grab for that surgeon's procedure. Okay, so it's also going to help you in processing, assembling, and distributing surgical instruments properly. Because as we talked about that life cycle of a tray, when you guys receive the tray, you're getting it dirty, you clean it, you inspect it, you sterilize it, you put it in storage, and you deliver it back to the OR. What you'll notice in most storage areas is that they're organized by department or by body system. So you will see neuro for neurological procedures. You'll see cardio for cardiac procedures. You'll see orthopedics for ortho procedures. If you know what those things are, it's easier for you when you go to put those 100 trays away to figure out where do they need to go. And I know it sounds like it's overwhelming, but I promise you, once you get into your field and you start learning these instruments and you can see them and hold them and touch them, within the better part of a year, you guys will be amazed how quickly you are able to identify, sort, identify and tell me exactly how to clean, identify and tell me exactly how to sterilize. Okay. All right. So levels of organization in the human body. We're going to start with the smallest part of our body, which is our cells, and then our tissues, our organs, and that leads into our systems. Okay. So it's really important for you guys to understand the basic function of the cells, because the cells and how they shield themselves will give you a lot of information on how you need to clean them and what type of sterilant you need to expose them to. Okay. So your chapter gives you a pretty good breakdown of the body of a cell. And I want to remind you, as you're doing that reading, it's the key words that you're looking out for and the key words that I want you to be making flashcards about. Okay. So the first body system that we are going to cover is the skeletal system. And each one of the systems in and of themselves has a primary function. Skeletal system's primary function is to animate us, get us to move, right? All our bones provide a structure for our muscles to do that with. And it supports our movement. So we got key organs that are included in the skeletal system include the bones themselves, the joints that allow those bones to move in any given direction, the cartilage that cushions those joints, and the ligaments that help animate those joints. Okay, so something to think about that's common, right? Just in case any of these words are like, what? I never heard that before. A common ligament that we do surgery on in the operating room is your ACL. So that little tight tendon that's behind your ankle, that would be a ligament. Common surgeries, pretty much total anything. So you could think about total knee replacements, total hip replacements, total shoulder replacements. And then skeletal systems are also going to have a lot to do with breaks, right? So you will see us talking about bone reduction trays. You'll see me talking a lot about screws and plates, bone saws, drills, things that you need to go through those hard surfaces and then pin or plate those bones back together so that they grow properly. All right. Any questions about the skeletal system? I don't see y'all in the chat. And remember, I can't see y'all where y'all watching from. I can only see you if you pop in the chat. So if you have questions, do let me know. Muscular system. So the muscular system is made up of your muscles and your tendons. The functionality of them is to move you and to help you to maintain your posture. So key organs it lists here for your muscular system, it lists your skeleton, but that's because your muscles are hanging off of them, right? And then they're also talking about cardiac versus smooth muscles. So for anybody that's done the reading, can you tell us the difference between cardiac and smooth muscle tissue? I'm going to put a note right here for myself. Oh, hold on. I didn't click the wrong thing. There we go. That I asked y'all to define that. And it's okay if you don't know today. You can come back to the comments and add the answer once you find it. But give an explanation for the difference between cardiac and smooth muscle tissue. Okay? Common surgeries I just talked about are pretty much tendon repairs with muscle ruptures. So you can think about if somebody pulled or stretched a pectoral muscle. For the women, when we talk about C-sections, a lot of times what we're doing is cutting through a couple of really thick pieces of muscle. So that is going to be the space where you see those surgeries come into place. A lot of times with these surgeries, they have to do with what we call soft tissue instruments. So things that are going to be dealing with the skin or the muscles or the fatty layer that's just right underneath your skin. Those are things that we consider soft tissue. Can somebody tell me in the chat what would be something that would be considered hard tissue? If your skin and your muscles are soft tissue, what would be considered something that's hard in that space? I'll wait. Okay. And then for surgical instruments, oftentimes what we're going to be using are retractors and scissors. There should be pictures of these in your books if you have them. If you don't have a book, you really can just go to Google and put in surgical retractors, surgical scissors, and to get a visual of what that might look like. Boom. Thank you, friend. Thank you. I appreciate you being on top of it, Bones, right? Will be something that we consider hard. So that's something I'm going to need more of a drill to get through. Yes, thank you, Letitia. Boom. All right. Cardiovascular systems. Am I still on? Look, y'all didn't tell me y'all needed y'all slide change. Okay, now. Teeth, yes. Teeth will be something that's considered hard. That's a bone. And you will be using something a little more, I don't want to just keep saying hard, but just something that's a little more tough to get through that tissue. Okay. All right. So let me make sure I got y'all caught up where I'm caught up. Okay, great. All right. Looking at cardiovascular. So your cardiovascular system is going to include your heart and all of your blood vessels that go all over your body that pump blood out and back to your heart. This circulates your blood and circulates the oxygen that's within your blood. This also is doing a cleaning process as well when this blood is traveling around your body and bringing those things back to be filtered through your kidneys, through your liver, things of that nature. So the key organs in the cardiovascular system are your heart, your arteries, and your veins. And a common surgery, and this is just one surgery, you guys, that I have on my notes. Mind you, each one of these systems has a multitude of surgeries, okay? And that's something else that just to familiarize yourself, you could go to Google and say types of cardiac surgery, types of ortho surgery. I wouldn't spend a very long time looking through it, but just to kind of give yourself an idea. And don't forget that those procedures are also in your chapter 2, okay? All right, so a common surgery in cardiovascular is what we call a CABG. You'll hear me say it over and over again. I think I've already said it like 3 times. And that's a coronary artery bypass graft. That's a lot of words. If you're done studying chapter 2, though, this should make a lot of sense to you when I say bypass. A coronary artery bypass is going to take the coronary openings of your heart, the big tubes that function blood all out through your body. If they become blocked, sometimes they'll do a surgery procedure called a CABG, where they'll stick, like basically little needles into your heart passages to help clear them out. Cardiac surgeries usually have an abundance of surgical instruments because you're going through hard layers of tissue and soft layers of tissue to be able to gain access to the heart. In my notes, I talk about instruments that for vascular oftentimes includes a lot of clamps and forceps, and that really is an understatement. In general surgery, you'll have things, you'll have some clamps like peen clamps, but in cardiac surgery, your clamps will be one, far more many in number, and two, a lot larger. So where maybe a standard peen is 6 inches, once you start getting into cardiac, you could have clamps that are 12 inches, 18 inches long for some of the arteries that they're going to clamp off in the hearts and the bypass machines that they're going to put it on. Hey, friend, welcome in. And the bypass that they're going to put them on while they're doing the procedure. So those trays can usually be pretty big instrument trays. All right. So let's go over to slide 3. Fran made it in. Welcome, welcome, welcome. And don't worry for what you missed, because as soon as I'm done, this recording will be on the live section of the Candray Institute's YouTube page. All right. If you got questions, don't hesitate. Just drop them in the chat. Respiratory system. Your respiratory system is comprised of your lungs and your air passages. Your function of that is going to be to supply oxygen and to remove carbon dioxide. So similar to the cardiac system, it's not only supplying oxygen, but it's also cleaning the body as it goes and returns back to your lungs. Common surgeries include a lobectomy, which is the removal of a lung lobe. We oftentimes will do that if a patient has cancer. If there's a part of the lung that has died, they might have a lobectomy. But again, there are many, many, many different types of procedures that can take place for the lung, just giving you something that's common. And then instruments that would go along with that would include a little chest tubes. And just like the cardiac clamps, there are many, many different types of chest tubes, many different diameters. So you may have some that come very small, some that are fairly large. If you guys can think of, I don't know if you've ever had your teeth cleaned and you go to the dentist and they put that tube in your mouth to do the suction. The chest tubes are very similar in their function and what they're made out of. They're just usually a lot bigger. And same thing, they might put that into your lungs to suck out fluid, like say you had an infection or you had pneumonia, things of that nature. All right, on to the digestive system. So the digestive system is comprised of your stomach and your intestines. Its main function is to break down food and absorb nutrients. Its key organs are your stomach, your liver, your intestines, and your pancreas. Common surgeries for the digestive systems are colectomies, which is a removal of part of the colon. Something else I want you guys to be aware of with digestive system issues is that you may have a lot of instrumentation or products that you deliver to your operating room to maintain things like colostomy bags or feeding bags, or sometimes you'll hear us call them NG tubes, feeding tubes, to that same function. So just like you have that tube that they were sucking out all the goodness from your mouth, a feeding tube would be a little opposite in that it would insert and then feed liquid nutrients to the patient. So there's sometimes with our surgical procedures, it's not just having things that are for the surgery itself, but it's also for how we take care of the patients once their surgery is complete. With digestive or pretty much anything stomach, pelvic concerned, we will oftentimes use what we call laparoscopic instruments. Now, last Monday, I talked a little bit about minimally invasive surgery. And does anybody remember what the difference was between an open surgery and a minimally invasive surgery? If you do, just type yes in the chat. So for minimally invasive surgeries, we use what we call laparoscopic instruments. I would highly encourage you. There should be pictures in your book. Let me see if they have them in mind. There should be pictures in your book of laparoscopic instrumentation. If not, just go to Google to familiarize yourselves. Now, so you that's not something that the visual of it isn't something you will necessarily need for your test, but I think it's good to just kind of help you frame it all in your minds. I don't really have a good picture. But essentially, laparoscopic. Okay, good. I see a yes in the chat. So laparoscopic instruments are typically, essentially, I wish I had one, but essentially they look like tubes. Oftentimes they'll have a black rubber coating on them. And if you've ever had robotic surgery, or if you know about robotic instruments, the robotic instruments will have a long tube, and then at the end of it will be a very mini version of a larger surgical tool. So it might be a mini version of a retractor, a mini version of some scissors, a mini version of a clamp. And what they'll do is, instead of the surgeon opening you up and utilizing those big scissors, they can do maybe a 1 or 2 inch hole, insert the laparoscopic instrument, and utilize that function at the end to cut, snip, clamp as they go. That's what we mean when we say minimally invasive, because we are invading the body. We are pushing something into the body, but we're doing it at a minimum scale versus opening up a big slit, putting in a retractor, and cutting at whatever it is that we need to cut at, or clamping at whatever it is that we need to clamp at. The pros of a minimally invasive surgery is that you heal a lot faster because there's just less damage, less closing up that the body needs to do. Okay. So a lot of times, and also with minimally invasive surgery, you can utilize laparoscopic instruments for minimally invasive surgery for every single type of body system. Okay, so it's not just digestive system procedures that utilize them. GYN uses them, orthopedics uses them, everybody uses them. It's just to what degree and what type of procedures can they do that with. All right. And the reason why I added the note specifically for the digestive system is that it's the most heavily used minimally invasive surgical instrumentation in the operating room. You will have what we call lap appies, which is where they're just kind of looking around to try to see if they can figure out what's going on with the patient. So I thought it was apt to add it here. But like I said, you could use it for almost any type of body system. Okay, the next system up on our list is the urinary system, which includes your kidneys and your bladder. The function of that is to remove waste through urine. So all of your bodily waste that's coming from your blood cells, that's coming from the fluids in your body, are being filtered out through your kidneys and then sent out in your bladder via urine. Let me change y'all over. Key organs will be your kidneys, your bladders, your ureters, and your urethra. Okay, so your ureters and your urethra being a part of your kidney and bladder system. Common surgeries in this system are nephrectomies. Nephrectomies are the removal of your kidney, right? So we see that ectomy as that root word there. If somebody knows, and you should because it's on your screen, what does ectomy stand for? I'm trying to find out who reading and who not. Okay. I'm trying to find out. Who's wasting my time? No, I'm joking. I know you guys are on top of it. And I know some people are waiting for books. But I cannot stress this enough. Stay on top of your reading. Because we're only on week 1. Y'all 4 chapters in. When we get to the end of week 2, y'all going to be 8 chapters deep. Okay. Y'all catching up that hard. All right. Ectomy is removal. Yes. Thank you so much. I really appreciate the engagement. I really do. All right. So with the urology, with the urology system, your urinary tract system, not only are you going to have a lot of surgical instrumentation that you'll be using for these, but you will also be using a lot of what we call cystoscopes. So just like minimally invasive surgery utilizes those tubes with the many instruments at the end, it also utilizes cameras and scopes because we've made that little slit. Surgeon can't see, right? We didn't open it all the way up. He can't see all that. She can't see all that. They can't see all that. So they're going to also make another slit and insert a scope with a camera on the end of it. And that's going to give them their visual field of where to use these small instruments at. I added that to this section in particular because you almost cannot do a urinary system surgery without a camera and a scope. It's kind of basic. You're going to need to be able to see inside of a little bit of urethra, little ureter tubes. You'll have to have a camera and a scope. So in addition to your surgical instruments, your clamps, your scissors, your retractors, you'll also be sending them audiovisual equipment. Audiovisual equipment that you guys will be cleaning and sterilizing. Okay. So think about this. I gotta open this window, y'all, before I burn it. Think about how delicate your phone camera is. If I were to tell you I need to bring that into a sterile space, I gotta clean it, I gotta sterilize it. Most of our sterilization is high-level steam sterilization, high-temp sterilization, right? So that's got to be one tough camera, one tough scope in order for you to be able to do that process repeatedly. Now, that being said, they are also still delicate because those cameras and those scopes are made out of light cords and cables. So as tough as they may look because they're wrapped in stainless steel, I want you guys to always remember to treat them with care. They're very expensive, and some of them are very hard to come by. The last thing you want to do is break something and a patient can't have surgery because you didn't tow the place up. Okay? All right, reproductive system. So we got your male and your female organs. The function is to produce reproductive cells and hormones. And then specifically in women, I want to include your uterus to produce a child, right? So I know I've mentioned a few times about C-sections because it's one of the most common surgeries for women when it comes to OBGYN services, but also things like colposcopies, things like having your ovaries removed, having your testes removed. Maybe you have a guy that wants to do a little snip so he doesn't have kids, right? So all of those surgeries will fall under your reproductive system, and that includes your ovary, your uterus, and your testes. A common surgery we see in this space is a hysterectomy, which is the removal of the uterus. And I did mention OBGYN a few times. Also, guys, if you hear me say an acronym and you're like, what the hell? Feel free to type in the chat, okay? Because mind you, I've been doing this for 16 years, so I'm gonna speak it like it's a foreign, like it's a fluent language to me, but I know that it's foreign to you, and I want to get you fluent, okay? I don't just want to assume that because you folks are mostly ladies that y'all know what I'm talking about. All right, so OBGYN stands for obstetrics and gynecological services. Typically, they're going to be a combined department, although sometimes when you get into spaces that are more specialized, your birthing center and your OBGYN might be considered separate. Like there might be a space where just patients that are pre-birth are kind of hanging out and getting treatment versus folks that have given birth and are now receiving treatment. Common instruments for the OBGYN service are things such as dilators, curettes. So a dilator is just what it sounds like. It's an instrument that we push into a urethra or into a vaginal canal to dilate it, to make it bigger. So maybe it has closed up, so we would insert that and open that. They come in graduated sizes, so they'll get a little bit bigger each one. And that's meant for you to be able to then widen that with a larger space, right? A curette is something that you use to scrape out. So if you guys have ever seen those ones that they use to clean your ears, where it just kind of looks like a little hook and you put it into the ear and you can scrape the wax out, that's an example of a curette. And curettes we use in OBGYN services to scrape things like the uterus, but we also use curettes in ear procedures. We use curettes in orthopedic procedures to scrape out bone. So most of these instruments that I'm naming are used in multiple service lines. I'm just talking to you about what is most commonly used in their service line. And when I say service line, I mean body system. All right, so moving on to your nervous system. The nervous system includes your brain and your nerves. It controls the body functions and sensory input that your body receives. The key organs are your brain, your spinal cord, and your nerves. Common surgeries are brain surgeries and tumor removals. I think I typed that wrong. Excuse me. Brain surgery to remove tumors. I did type that wrong because I also wanted to list on there some. When I say brain surgeries, I'm talking more about cranial surgeries where we might put something like what they call a burr hole into your skull to relieve pressure. If you've got blood, like a blood swelling on the brain, they might create what they call a burr hole and release some tension there by removing part of the skull bones. And then, of course, like I said here, the removal of tumors. That's that cranio. That's for your head. And that otomy. What's it? Where it at? Help them again, Evelyn. What's that otomy about? All right. I have a note here for myself to discuss rongeurs and drills. I talked to you already a little bit about drills. Surgical drills really are what they sound like. Like how you have a power drill at home, we got the same thing in the operating room. They come in various sizes. The drill bits come in various sizes, but they are nonetheless drills that are meant to push through bone, create holes, places that we can put screws into, or they might be pushing some type of product into to help congeal it. May serve different functions, but they use quite a bit of them. Also in your spine surgeries and in your neurosurgeries, oftentimes in your ortho surgeries, you will find rongeurs. There should be hopefully a picture in your book. Let's skip through and see if I see one. If not, just Google that. Rongeurs are instruments that are what we call a punch instrument. And it's something that you put into the body to make a small excision. So you can kind of think about it like, I keep going back to colposcopies because I got my ladies here. But if they're putting an instrument into you that's going to do a little cut and take some tissue out, that's something that you could think about as a punch instrument. And rongeurs are that. Okay. Almost to the end of chapter 3. And then I'll pause for questions if you guys have any. Endocrine system. So the endocrine system is made up of your glands and your hormones. It regulates your metabolism and your body functions. The key organs here are your thyroid, your adrenal glands, and your pancreas. So everything that you need to make all of the chemicals that make your body run. And then with this, my note on here is about delicate instruments. So I'm going to talk a little bit about handling. Now, just like I talked about those cameras and scopes being delicate, your endocrine system instruments, a lot of your eye instruments, oh my God, I did not put eyes on here. I will go over that and then I will add it to the notes. They will have very tiny, very small, very thin surgical instruments that are very delicate. So same thing for your neurological instruments, because remember, that includes your nerves. Doing surgery on nerves requires very fine instrumentation, stuff that is really easy to break when you're handling in the sterile processing department. So please, I beg, as somebody who used to be responsible for ordering that stuff, handle it with care, okay? Handle it with care. Because the thing with surgical instruments, we can always order and replace. That's a beautiful thing. However, it's not Walmart. You cannot just go grab those things quickly and have them be replaced. So it's just, we make mistakes. I don't want you guys to feel like if you break something or tear something up, it's like, oh my God, it's the end of the world. They're going to fire me. Most likely not. However, it won't be available for your patients for quite a bit. So, just do the best you can to be as gentle as you can. All right. So that is the end of my notes on chapter 3. Any questions about that? So like I said, it's pretty much basically an anatomy 101. I do want to highlight that you go back and you're doing that reading and you're making notes on your systems. I did not talk about the eye system or the ear system. But your eyes, of course, are going to include your actual eyeball, your eyelids, and then specifically for the anatomy of your eye, your irises, your cornea, your pupils, all that can indicate what type of surgery they're going to be doing, like if it's going to be a cataract removal, things of that nature. Very small instruments, very fine. When we get into cleaning, you will notice that cleaning eye instruments is very different than cleaning any other surgical instrumentation. And that's because of these soft membranes that are exposed. They take a little bit more care. And then the same thing for your ear system is going to include your eardrum, your ear canal, your inner ear, your outer ear. They're going to be smaller instrumentation. Usually they're a little, what I would say, harder. They're not as delicate as like an eye instrument set would be or a neuro set would be, but they are very tiny, right? All right. Any questions on chapter 3 or anything that we've covered so far? All right. I don't see none. Y'all got it then. Y'all got it. Chapter 4. Chapter 4 is the microbiology for central service technicians. I would say this chapter is one of the most important chapters that you have. Second only to chapter 2, which was your root words, your procedures, and your conditions. And I say that because microbiology and then the actual surgeries themselves comprise the majority, I would say, about 80% of the knowledge that you need to have in order to do this job effectively. It is very easy to forget about microbiology when you work in the sterile processing field or just as a human, right? Because you can't spend all day thinking about every single germ that's around you unless you want to go all the way crazy. All right. But for you guys, it's very important that you keep it on your mind because that's what we are protecting our patients from, is these microbiology layer of germs that could infect them. All right. So chapter 4, microbiology. Let me change my slides so you guys can see. Okay. Introduction to microbiology. Microbiology is the study of microorganisms, including bacteria, viruses, fungi, and prions. My bet most everybody in here has never heard of a prion before. You will when you finish this class. Okay. You will when you finish this class. But the other ones, I bet, are fairly more common to you: bacteria, viruses, and fungi. All of these are microorganisms that we are trying to clean. We are trying to reduce their number, their quantity. And then when we put them into terminal sterilization, we're trying to reduce them all the way down to 0 so they are not even present. The reason why this is important for CS technicians is because it helps prevent surgical site infection. Now, last week we talked about HAIs. Put in the chat if anybody remembers what an HAI is. Surgical site infections are another type of HAI. Surgical site infections are an infection at the surgical site. I know it sounds like I'm repeating things, but I'm repeating it on purpose because I'm drilling it. It's an infection that is found at the surgical site post-surgery, meaning that spot of skin was clean before surgery. We did surgery, patient went home, and now the patient is back and the patient has a infection, a SSI. Just like HAI, I don't see nobody in the chat about HAI. That's what I'm about to say. Okay. Eagle Lynn got y'all. Hospital-acquired infection, as in an infection that they did not have before they came to see us. They got it while they were in our building. Same thing with a SSI. That's an HAI specific to the surgical site, an infection that the patient did not have before they came to see us. Now, where did it come from? SSIs, just like HAIs, could come from a plethora of places. It's the reason why we got to keep that hand hygiene going. It's the reason why you guys have to wear your PPE. It's the reason why even down to your scrubs and your shoes is highly recommended, and most departments have a policy that you all will have to Change clothes once you get into the hospital. Change shoes once you get into the hospital. And have a dedicated pair of shoes that never leave the hospital. Why? So that you're not bringing in any bacteria, viruses, fungi, or prions with you and giving them to our patient. You most likely will not know if you were to do that, right? If you were to bring something in on the bottom of your shoe, if you were to bring something in on your jacket, you would likely not know. However, and that doesn't mean that it won't have an impact. I think back to working at Kaiser Oakland, and we had a case there that was prior to my time in which a mother lost her toddler. And what happened was that toddler came in for surgery, and that toddler contracted an HAI. And it turned into a SSI, a surgical site infection, and ultimately that patient lost their life. Now, when the investigation was completed, what they found was someone, a random scrub tech, sterile processing tech, nurse, surgeon, transporter, walked outside with their hospital dedicated shoes to go do a smoke break, a lunch run, whatever it is, track something back on their shoe. Somebody dropped something on the floor, picked it up, put it on the table. That thing touched this thing, and now the baby is dead. I say all that to say I'm going to be drilling y'all with these over and over again. I'm not trying to make you paranoid, but I also want you a little bit scared. I feel like if you ain't just a little bit terrified of this job, you ain't doing it right. Because every single time you guys enter into the department, you have the potential to help or to hurt people with simple everyday actions. And you will quickly find there are technicians that work right beside you that don't give a damn. Okay? They're not wearing dedicated shoes. They're wearing the same pair of tennis shoes they came from home in. They're not changing out into clean scrubs. They're wearing scrubs home and wearing them back. They're bringing things into the department without cleaning them, like bringing their cell phones in without wiping them down. It can become something absent-minded, but can have such a great impact on your patients. All right, so we want to, through learning about microbiology, reduce and prevent the instance of SSIs. We also want to ensure proper sterilization and disinfection, because just because we take it through the process doesn't mean we did it right. And if we did it wrong, again, same potential outcomes. And I know it might sound a little crazy when I say this, and you will probably hear me say this about 1 million times between now and April. Death is not the worst thing that you can do to somebody. Because when they die, they are not suffering. That's my personal opinion. I think some of the worst things that you can do is give somebody a SSI that requires them to have to come back and have what we call a washout. A washout being that we open up that wound and they're rinsing it with items that can help reduce that infection. You could cause a patient to have to come back multiple times for something like that. You could cause a patient to have an infection that requires us to amputate a limb. You could cause an infection that requires a patient to come in for routine and regular testing for the rest of their natural lives. You can cause suffering as well. So it's important for you guys to take this information seriously and to practice it on your jobs, even when and if other people are not practicing at the same level as you. Okay, types of microorganisms. So we talked about bacteria. These are your single-celled organisms. Things like Staphylococcus. How many people have heard of a staph infection before? That's Staphylococcus. It's going to be, I could go into a million, but bacterial infections are something that are probably be some of the easiest ones for you to transmit, and viruses, okay? Viruses are organisms that require a host to live. So what I said, you can have somebody that gets an infection and have to come back for repeat care, repeat surgery, messing around with you. Didn't have hepatitis before I came to surgery, but now because Letitia in here kind of acting up, now I got to come back once a week for my medicine. Who wants that? Nobody wants that. Things like HIV. Nobody wants to take that home. Nobody wants to take that home to their families. And I know damn well you guys do not want to contract that. Okay. We have fungi. This includes molds and yeast like Candida. Another thing about molds and yeast is that they can be airborne as well. So it's very important to make sure that we take care of getting those off of our instruments, getting those things clean. And there are a few different type of fungi and prions that require special cleaning processes in order to make sure that we render that instrument safe. Prions. These are infectious proteins. And specifically what's important to know about these infectious proteins is that they're very, very, very hard to kill. Very hard to kill. So that's why I said we have special procedures, and we'll talk about that when we get to sterilization on how to take care of them. Also, with this Creutzfeldt-Jakob disease, this one in particular, I've only run across, I want to say twice in my career. And it's something that with that prion, with it being a prion, you actually don't reprocess those instruments, you throw them away. So we're talking about thousands of dollars worth of surgical instruments, but because they have been exposed to prions, honey, they go straight into the trash. All right. I've talked about this a little bit with the various microorganisms and their sterilization methods. It's mostly going to depend on what type of instrument you have, whether or not you're exposing it to a high temp or low temp sterilization method. And then those prions, like I said, when we get to the sterilization section, we'll talk about what makes them very different from any other surgical instrumentation. All right, so methods of microbial control. We talked about all these different bacteria, viruses, fungi, prions that are going to be coming. They're coming. Okay, the only thing guaranteed in sterile processing is that they're coming. Hello, Xenon. Welcome to class. Welcome to class. Don't worry about what you missed when we go off the live. The recording of this will be in the live section of the Candray Institute YouTube page. Also, Monday's class is there as well. Okay, so microbial control. What do I mean when I say microbial control? Because we know that those microbes exist. Like right now, we know that there are microbes all over my hands. There's bacteria, hopefully not no virus, but tons of bacteria all over my hands right now. We can't see it, but it's there. How do I control it? I might do something like remove visible soil. I might do something like wash and sanitize my hands to try to mitigate or to try to control how much bacteria, viruses, prions, whatever it may be, fungi that are on the surface. Okay, so some of our controls are cleaning, removing the visible soil and the bioburden. Somebody tell me in the chat what bioburden is if you were at class last week. What is bioburden? Give me an example of something that is bioburden. Disinfection. Disinfection is the reduction of pathogens using chemicals. Why is cleaning and disinfection two separate things? Cleaning is the removal of the gross soil, the things that I can see, the mud, the blood, the snot, the poop, the stuff I can see. That is cleaning when I remove that. Now, if I had, I know I'm being kind of gross, but I'm just the surgical instruments, right? Sometimes we use these things, these bodily fluids. If I had poop all over this hand right now, and I wipe it all off, you can't see any more poop. Is this hand clean? Type a yes or no in the chat. Is it clean? Is it clean or not? All right. Eaglean says, bioburden, an instrument that is soil from a previous procedure. Close. It's not necessarily the instrument itself, but it's all of the tissue, the blood, the plasma, the snot, the poop that's left behind, all the soil from that previous procedure. Thank you so much. No, it's not clean, right? If I wiped all the poop off and just kept it pushing, no, it's not clean. It's not safe to handle. It's bioburden. Yes, it's straight up bioburden. It's dirt. Bioburden would be fluids found on the instrument. That is an example. Yes, it is. All right. So I cleaned it off, but now in order to render this clean and safe to handle, I have to disinfect it. I have to come at this with some alcohol, some bleach, some hydrogen peroxide, some steam, something to kill all the microbiology that's on my hands right now before I can say that thing is safe to handle. Okay, so that's where disinfection comes in. And that is the reduction of the pathogens using chemicals. So say I have 1,000 pathogens left on my hand. I'm going to use a chemical, whether it's steam, hydrogen peroxide, alcohol, glutaraldehyde. You guys will come to know what all these are. I'm going to use that chemical to kill all those bugs as much as possible and reduce it down to safe levels. And I'll say again, you almost never get to zero unless you're talking about sterilization. Now, sterilization, we talked about this before, terminal sterilization is the complete elimination of all microorganisms. So now I'm going to ask you guys a question. Can you sterilize something that isn't clean? Yes or no in the chat. Can you sterilize something that isn't clean? Can I take something with bioburden on it and put it inside of a sterilization machine and have it come out safe to handle? Yes or no in the chat? No, I can't do that. Can't do that. Can't do it. It's impossible. You have to clean, you have to disinfect, you have to sterilize in that order. And always that order. And if anybody ever tells you not that order, you tell them to call me. So I can lay the smack down. And I've had to do it before. I've had to argue with surgeons and nurses and stuff before because they don't know. They specialize in what they specialize in. You guys specialize in what you specialize in. They didn't go to school for this. You did. All right. So the Spalding classification, when I talk about the reduction of germs, I'm talking about specifically the Spalding classification. This is going to be in your textbook. I don't have deep notes here. I'm not going into it heavily, but I do want to go over it in that the Spalding classification is going to give me a map of how much or how little bioburden microorganisms are on a surface. If that are on a surface, I'm saying that wrong. Scratch what I just said. It comes in on the back end. The Spalding classification is going to tell me what type of tissue I'm being exposed to, whether it's a critical, semi-critical, or non-critical tissue. And that's going to tell me how clean it has to be. Because remember, until we get to terminal sterilization, we're not getting rid of all the germs. We're getting rid of most of them, but not all of them. If I'm doing a procedure on something that the Spalding classification considers dirty, like a throat, I might not have to go to the highest level of sterilization for that instrument because this cavity is considered dirty. Same thing with the anus. It's considered dirty. So I might not have to get it as clean as if I wanted to do eye surgery or if I wanted to do cardiac surgery. The Spalding classification helps you with that. Any questions so far? All right. Okay. So we've kind of gone over this just in talking about how germs work, but this section talks about the chain of infection. And it's very important for you guys to memorize this and get this down, not only for your test, but for your safety in the department. Okay, so the chain of infection, the first step that we have is a causative agent or a pathogen. Causative agent, the germ, the virus, the prion, the fungi. Then we have a reservoir, which is where the pathogen lives. That could be your throat. Let's say you're walking around with a cold. That reservoir could be your throat. Now you're coughing. You're giving your causative agent a way to get out into the world. It now has a portal of exit or how it leaves the host. So it could be a cough. It could be a sneeze. It could be because you cut them open and now that dirty whatever it is on the end of the instrument. Now you have a germ, a causative agent, a pathogen. You had it in a reservoir wherever it was hanging out. Now you've given it a mode to exit. And up here on my notes, these are how you fight those things. So how do you combat a pathogen? A causative agent, a pathogen, you sterilize it. How do you protect your environment from not having reservoirs or places where germs can happily hang out? You clean it. How do you protect yourself from not capturing somebody's cough? You have on your PPE. That's how you can block these things, how you can break the chain of infection. Number 4 is the mode of transportation. So that's how the germ gets from one place to another. Maybe you picked it up like that thing for the baby. They picked it up off the floor. You didn't put it on a cart. Now it's rolling, right? It's going from one place to another. Or maybe you came into the department and you did a handshake, but the person didn't do hand hygiene like the Candray Institute taught them to do. And now you have given that a mode of transportation. How can you block those things? Clean hands save lives, guys. I'm going to say it 1,000 times. Clean hands are going to take you 99% of the way there. Keeping your hands clean. And then also, of course, we talked about sterilization. Then we have a portal of entry. So the vector then got out. We didn't transported it to another room on our hands. Now it needs to get into the new place. So portal of entry is going to be how it enters the new host, right? So if it was that cough, I cough, it now traveling over the air. That's its transportation. And it gets breathed in. It has made a portal of entry. Number 6 is susceptible host or the vulnerable person. So all of our immune systems are designed to fight off of infection to various degrees. Depending on how healthy our immune system is, we may find ourselves to be what they call immunocompromised, right? Somebody that is very susceptible to getting an infection versus somebody that has a really strong immune system that's able to fight things off. Unfortunately, when that bug or that pathogen finds a susceptible host, it could cause that infection, right? So now that person has the flu, or that person has the cold, or that person has the COVID, right? The person has the HIV. How can we minimize that? We use our infection control measures. What are our infection control measures? Everything that we just talked about. Do I not have that up for y'all? Y'all gotta I'm sorry, y'all. Don't let me change these. I don't have it up for y'all. Remember, if I'm saying something you don't see on the screen, it's because I forgot to change the slide, okay? I'm looking at 2 different things. Don't hesitate to ask me a question. All right, so we talked about that susceptible host. That person has captured that disease. And what your infection control measures are is everything that's on the other side of this paper. So that's going to be your proper sterilization, your environmental cleaning, your proper PPE use, your proper hand hygiene. You're making sure that you're keeping germs from being able to travel to other places. That's infection control. That's microbiology control. All right. I cannot emphasize it enough. Hand hygiene and proper PPE use. And I say it to you over and over again because I've worked in the field for a number of years. And I promise you, somewhere right now, there's a sterile processing technician in a decontam room that does not have on their proper PPE. They just don't. They don't have on their gown. They don't have on their gloves. I've seen techs put their hands in water with dirty, bloody instruments. I had one lady, she was an older lady, and she told me that when she started in sterile processing, they didn't wear gloves. And so for her, she thought it was kind of a punk move that all these young people had came in and wanted to wear gloves. And I had to argue with her. I had to eventually write her up because she didn't want to wear her PPE. And what I can tell you for sure is she probably doesn't have a strong foundation on microbiology. Otherwise, she would have been quick to put them gloves on. Okay, now we're going to talk about something called biofilm. This is something you guys are going to hear me talk about a lot because biofilm is going to be your arch nemesis as a sterile processing technician. Biofilm is a protective layer of bacteria that forms on instrumentation. And what happens is over time, if we've exposed that instrument to some blood or some other bodily fluid, and then we leave it there, and it takes a really long time for us to get to clean it, what's happening is all of those germs are multiplying. They never stop multiplying, right? That's why we always try to clean and reduce them because they're designed to multiply. The longer you let that instrumentation sit, the more layers of cells it creates. The more layers of cells it creates, it turns into what we call a biofilm, a thin film. Kind of, you can think of it almost like a gray layer, although, mind you, you may not be able to see this at all. Most likely you won't be able to see it at all because it's microbiology, things you need a scope to see. And it's building up that layer. And essentially, just like anything, just like if my skin was building up a hard crust, it's protecting whatever is underneath me, right? So that hard layer of biofilm is going to be outside, and there's going to be a crap ton of of germs that are underneath it. The more biofilm you create, the harder it is to clean that instrument. And it might mean that you have to go through extra procedures in order to get that instrumentation safe to handle. All right. So to remove it, the removal of biofilm, just like the removal of bioburden, it requires a manual and an enzymatic cleaning before sterilization. When I say manual cleaning, I literally mean putting the instrument into some water with enzymatics. Enzymatic is our detergent. It's our, you can kind of think of it like our Dawn or our Tide. And we're going to get into what enzymatics are when we get into the cleaning section. You're going to put it into that water with those enzymatics, and you're going to manually brush. You're going to manually wipe. You're going to manually scrub and take those biofilm levels down. We also utilize automated cleaning. I need to add that to my notes for you guys. We will manually clean and prep something. So just like when you're doing dishes for a dishwasher, you might take it to the sink, rinse it off, put it in the dishwasher instead of taking the plate straight with the food on it and putting it directly into the dishwasher. The sink portion will be considered the manual clean. The automated cleaning will be when you put it into the dishwasher and you press start and that machine starts to automatically do cleaning. Most dishwashers these days will do a terminal sterilization at the end of the cycle in which it pushes steam into the machine and you open it up and it's like a little cloud of steam comes all out, right? That is it doing a terminal sterilization. So it cleaned it for you and now it's disinfecting it, making it safe to handle. All right. So that is the end of my notes for chapter 4. At the end here, I just have a note to talk about the importance of microbiology, but I think I did that with you guys. I think you understand why I'm saying it's so important for you to have a deep understanding of how cells, viruses, bacteria, prions, and fungi work, what they're resistant to. That's going to inform you on how you clean them, what type of temperatures you need to expose them to, even down to lengths of time you might need to let them soak, things of that nature. Any questions about the chapter 4 material? I'm okay. I'm going once. I'm going twice. Let me flip to the book and see if there's anything else I want to add. You'll see the word contaminated here. Contaminated literally means dirty. So if it's got any of these bugs on it, it's considered contaminated. It's not clean until you clean and disinfect it. They go over different various bugs. That's pretty much it. That's the big ticket stuff in there. Okay. So I don't see any questions popping up. That's all I have for chapters 3 and 4. So for this week, we covered chapter 1, Introduction to Sterile Processing, chapter 2, which was your terminology, chapter 3, and chapter 4, which we just went over today. If you guys want this, do you guys want this? I can take my lecture notes out of it and you guys can just have it. I guess it's like a study guide if you want it. Honestly, I'm not entirely sure I would say you need it, but if you guys want it, I can send it out in an email. The biggest thing is, and I know I keep saying it, but the biggest thing is going to be your vocabulary. Make those flashcards. Anywhere you see a box of vocab inside that book, make a card. Okay? Yes, you guys want that? Okay. I'm happy to send it out. I'll take my lecture notes out of it and I'll send them out this weekend. Okay, cool. Cool. We'll get those out. I'll send those out to you guys. I also made a little, we're over our hour, so I don't want to keep you guys too long. And if you have your workbook, you already have chapter quizzes and tests. But for you guys that didn't, I did put together a little chapter 1 through 4 quiz. It's just 10 questions. If you would like that, let me know and I will send it out. I don't know if you guys want to hang out. We could do it together right now or what y'all want to do. Tell me, because I know it's been an hour already. I don't want to overwhelm folks. But I can send this out to you too. It does have the answer key in a separate page. Yes, you guys want this? Okay. Cool. All right. I'll send that with it. So like I said, if you've got the workbook, that you have version of this already. Just for those of you that don't have it, I thought that might be helpful to kind of challenge yourself on your chapter 1 through 4 reading. Now, y'all saying yes, did y'all want to go over it now? Or do y'all just want to have it? Let me know. And then while y'all are telling me about that, let's take a look at next week. So this week we covered chapters 1 through 4. Next week on Monday, is that Monday? That's Monday, right? Monday 2/17. Monday 2/17 is President's Day, but I'm a Black woman. I don't know what that means. Supposed to mean to me. I'll be here. I'll be here at 4:45. Both you guys want to go over it? All right, so one person wants to have it, one person wants to go over it. Okay, so I'm gonna go over next week's stuff, and that way, if anybody wants to jump off now, you're more than welcome. And then I'll go over the quiz if you want to hang out for it. Okay, so just a preview of next week, 2/17, 2/19. We're gonna be doing chapters 5 and 6 on Monday, which is cleaning and decontamination. And then on Wednesday, we'll be covering chapters 7 and 8, which is going to talk about sterilization principles. Those both will be 4:45. Like I said, Wednesdays I can hang out longer, like we're gonna do tonight if you guys want to. Mondays I got a jet. in between, in the interim, if you come across something you need help with, you have a question, you can email me at the Candray Institute at gmail.com. I'll put that on the screen just in case for some strange reason you don't already have this. I think most of you guys are from TikTok, so you should have the website, Gmail, all that fun stuff. Oh, I can upload these notes to the website too, where you guys got your Hillman Talk class schedule from too. I will do both of those. I'll send it in an email and I'll upload it on the website. So in between then and now, if you have questions for me, you can send them via email. I'll try to get them out as quickly as possible. Okay, so that will be the end of class 2 tonight. If anybody wants to jet, thank you so much for hanging in with me. And then for you guys that wanted to hang out and do the quiz, let me get it up on the screen for you. And let me change it on my big screen, because I'm blind as a bat. I ain't gonna lie to you. Okay. So this is a real quick 10 questions over chapters 1 through 4. Question number 1, and you guys can throw your answers into the chat. What is the primary role of Central Service Department or the Sterile Processing Department? What is the primary role? Is it A, to assist in surgical procedures, B, to clean, sterilize, store, and distribute medical instruments and supplies, C, to diagnose and treat patients, or D, to manufacture medical devices? What's the answer? Primary function. All right, I see some B's coming in. B. So you guys are saying B, to clean, sterilize, and store, distribute medical instrumentation and supplies, and you would be correct. That is your main function. You are not a surgeon. You are not a nurse. You are the expert on these surgical instruments, and don't let them make you forget it. Number 2, which of the following areas in the CS department is considered the dirty area? A, prep and packaging, B, sterile storage area, C, decontamination area, or D, central supply area? Which one is considered dirty? All right, Letitia coming in with that C. I see some C's coming in. C, and you guys are all correct. The decontamination area is the room where we clean the instruments at, and that is always going to be considered dirty. Number 3, what organization establishes best practices for sterilization and medical equipment processing? Now, this one you might not know if you ain't do the reading. Answer A is OSHA, B is CDC, C is FDA, and D is AMI. Which organization tells sterile processing industry what the best way to sterilize medical instrumentation is? Is it A, OSHA, B, CDC? I see a B came in. C, FDA, or D, AMI? Okay. So I only seen one. I see some B's. Oh, I see some B's. Hold on. Let me see. Let me see about B. Close. We got some D's coming in. Some D's. All right. So the answer is D. Now, that being said, the CDC and the FDA will have some guidance for us, but AMI, which is the I think it's American Advancement of Medical Instrumentation, AMI is the group that gets together that gives us guidance on best practices of sterilization and medical equipment. The deeper we get into the book, you'll hear me say AMI and ANSI quite often. All right. But CDC and FDA are very solid guesses, guys. Okay, number 4. This is from your terminology section. Which prefix means below or under? A, hyper, B, hypo, C, intra, and D, endo. Which one means below or under? Below or under? Hyper. Hyper is a good guess. Hyper is a good guess. I see hyper. I see an A. I see a B. I see a B. Okay. All right. We getting there. So the answer to this one is B. Who got my B's? All right. The answer to this one is B. So hypo means below or under. Think of hypodermic, like under the skin. Hypo, under. All right. Number 5. What is the correct term for an instrument used to hold back tissue during surgery? I talked about this one during class a couple times today. A, scalpel. B, forceps. C, retractor. D, curette. What's the correct term for an instrument used to hold back tissue during a surgery? A, scalpel. B, forceps. C, retractor. D, curettes. I'm seeing a few things. C is the correct answer. It is a retractor. It retracts tissue. Awesome. You guys are doing so good. I'm so happy. Okay. Number 6. Which of the following terms refers to the absence of a disease-causing microorganism? The absence of it. A, pathogen. B, biohazard. C, sepsis. Or D, asepsis. Which one refers to the absence of a pathogen? We didn't cover this in class, but this is in your reading. All right, I see the D pop in. See a couple D's pop in. The answer to that question is D. It is asepsis. Asepsis is the absence of a disease-causing microorganism. Right, and then just from what we have up here, this is an awesome example, too, of doing process of elimination on your test, because you might not know the answer to every single thing you see on a test. But if you know the foundations, it's going to make it easier for you to guess your way into a right answer. Now, if I was to say, I hadn't heard Alessandra talk about asepsis yet, but I have heard her talk about pathogens, and I know that that's a bug. I've heard her talk about biohazard, bioburden. I know that that can't be something that's free of disease, free of microorganisms, because it's got stuff still on it. Sepsis is an infection. So the only answer that would even make sense is asepsis when we talk about absence. Also, if you're looking at your root words, A would have been your key note, because A would have been the absence of, or the thing of it being without. So sepsis being infection, asepsis, no infection. Number 7, what is the purpose of the autoclave in the sterilization process? We haven't really exactly got into this just yet. So I will not be sad if you guys missed this one. So what is the purpose of the autoclave in the sterilization process? A, to disinfect instruments with chemical solutions. B, to kill all microorganisms using steam under pressure. C, to rinse instruments before packaging. Or D, to store sterile instruments until use. What y'all got? I see this A. This is from last one. Might be from the last one. 606. Or y'all just own it. Y'all might be just own it. Okay. So purpose of the autoclave in the sterilization process. Autoclaves, the answer is going to be B. I don't know that I've used the term autoclave with you guys just yet. Autoclaves are steam sterilization machines that utilize a pressure jacket to push steam into a chamber and expose the instruments to that steam. You can think of it like a large pressure cooker. So if you guys have ever seen a pressure cooker, where you would put your meat or whatever it is into the pressure cooker, put your water in, put the lid on, and then that steam is going to be trapped and recirculated and create wonderful beautifulness inside that pot. Same concept with a autoclave sterilization unit. It's going to take your surgical instruments into a machine, close the door, pump steam all around it, and render it sterile. All right. That's number 7. So the answer to that one will be B, to kill all microorganisms under steam pressure. Number 8. What surgical procedure involves the removal of the gallbladder? A, an appendectomy. B, a cholecystectomy. C, a laminectomy. Or D, a hysterectomy. Which one is removing a gallbladder? What we got? What surgical procedure involves the removal of a gallbladder? A, appendectomy. B, cholecystectomy. C, laminectomy. Or D, hysterectomy. All right, I see an A. I see an A. Anybody else? No worries, we're just challenging ourselves. All right, so the answer to this one actually is B, a cholecystectomy. That chole is what's going to be your keyword for your gallbladder when you get ready to look at your chapter number 2. And your ectomy is the removal. So let's look at those other ones. Appendectomy. That's going to be the removal of your appendix. Laminectomy is going to be a neurosurgery in which they're doing, how would I say? They're going to be doing a neurological surgery on your spinal discs. And then D, your hysterectomy, that is going to be the removal of your uterus. All right. Number 9. 2 more. Number 9. Which body system is responsible for transporting oxygen and nutrients throughout the body? A, muscular system. B, skeletal system. C, cardiovascular system. Or D, respiratory system. Which body system is responsible for transporting oxygen and nutrients throughout the body? Muscular system. B, skeletal system. C, cardiovascular system, or D, respiratory system? All right, see a few coming in. I see a couple D's, a couple C's. Okay, the answer to number 9 is C. Cardiovascular system is what transports your oxygen and your nutrients via your blood. And the last question for today, number 10. What does PPE stand for? You guys have already done this a few times, so this should be so easy for you guys. What does PPE stand for, and why is it important to the CS department? A, proper processing equipment ensures instruments are sterile. B, protective personal equipment protects CS workers from exposures to contaminants. C, professional performance evaluation measures technicians' job efficiency. Or D, prepackaged equipment used for surgical procedures. Who got it? Come on. Glenn? I don't know. Got it. Personal protective equipment is the answer. PPE stands for personal protective equipment. And look, I'm going to pop. Y'all knew what it was because y'all on top of it. On top of it. And remember, that includes your gloves, your eye shields, your gowns, your shoe covers. Sometimes we have sleeves that cover your forearms. Sometimes for the guys, we have beard covers. You'll have a hair cover. All of that is your personal protective equipment to stop bugs and pathogens from having a portal of entry into your body. Okay? That's it. That's all I got for chapter 1 through 4. Then we talked about what we're looking at for next week. I do highly encourage you guys. I love that. I do highly encourage you to do your reading over the weekend. If you've got your books, get caught up on your reading for this week and start reading the next 2 chapters. I believe it's what we on, y'all, 5 and 6 for Monday. So that way, if you have questions, you can ask them during class. Okay. Feel free to email me if you guys need me in the interim. Otherwise, I will see you guys next week on Monday at 4:45. If for some strange reason you can't be here, don't freak out. The recording will be on the YouTube website or on the YouTube page under live, because since I'm airing this live, it will be under the live section. It won't show on the regular stream. Okay. And I'm going to throw my email up there one more time, just in case you guys need it. Please do send me your email addresses. You can DM them to me on TikTok, or you can just send me a straight email and say, hello, my name is da-da-da-da. Especially if your name is different than what's on your YouTube, just so I know you guys. And I want to start sending out newsletters and information and stuff directly to you, because although I am posting a little bit of stuff on TikTok, you guys are the ones that are taking the class, right? So I want to make sure that you're getting direct information. And then the last little thing I want to remind you all of, in case there's anybody that joined us late, or I actually do see we have new people here this week, don't forget to go to the Wix website, which you can get to from TikTok, and download the course schedule. And I will be having these lecture notes and stuff up there for you guys as well. Okay. All right. Listen, my name is Latoya. Okay, Latoya, hi. I'm so happy that you're here. And Letitia says, my sister sent you a message and she joined the live. She just needs to get her books. Cool. I love a family that wins together, baby. I love that. That makes me happy. That's beautiful. Feel free to jump in. I think as far as me personally taking on the responsibility of additional students, I think after week 3, I'm going to shut that down. So like, as in, I'm not going to be adding more people to my newsletter list and stuff like that. But all of this stuff will be up for the duration of this class being free. So if people are jumping in late, cool. That is perfectly fine with me. I just don't want to overwhelm myself trying to catch people up from, 4-5 weeks back when you and I are already at the end. Okay. Yay! I'm going to be nosy. How old is he? This is a great class too for high school students. Once they turn 18, they're eligible to work in the hospital, and all you need is a high school diploma. So it was something that I did to help myself when I started college. Instead of just, or I won't say just, but because now they're making pretty much the same as far as like McDonald's and just some of these other type of jobs. But to be a student and be able to have health insurance and to be able to have a 401k, to be able to have a job that gives you tuition reimbursement, those are pretty big benefits to have. Okay, he's 21. I love this. Beautiful. I love this. It's a yay for the young people, especially the young Black men. Get you a career. Oh, okay. But yeah, it's a nice way to go. And same thing for you guys. I'll have a section particularly about the financial benefits. But one of my favorite things about stuff like this is once you guys have your certification and you're able to get into the hospital, you can take advantage of things like tuition reimbursement to help you pay for college classes or additional certifications if you want. Like a lot of departments will reimburse you. So you know how class 1 we talked about, there's the basic CRCST and then there's the CHL, CIS. And I don't even think I talked about CER, but there's a scope 1 as well. If you get hired on these positions, they may be willing to reimburse you for the cost of a test, reimburse you for the cost of books, help you pay to go to conferences, things of that nature, because they want you to be educated. They want you to know what's going on. So it's a really great way to help set yourself up to do all kinds of things if you want to. You don't have to go into sterile processing and just saying, oh, I'm going to be a sterile tech for the rest of my life. You can if you want. It's a wonderful career. But you can also use it to segue out into other things, which I think is pretty cool. All right. Yay. So we are 30 minutes over our time. I'm going to go ahead and let y'all go. I think I'm going to plan on, like I said, I think I said this like 3 times. I had to repeat myself, but we're making this up as we go. So Monday nights, I have a hard stop. I can't stay over, but Wednesday nights I can. So I'm going to plan for myself to be here 30 minutes over. And that's just for if y'all want to hang out. If y'all got questions, or maybe we can do a quiz, or maybe we can review some flashcards together, stuff like that. But you're not, of course, required. You're not required to do anything. But you won't be missing anything in the class if you hop off early. Okay? Y'all have a beautiful weekend. Get your reading done. Do your flashcards. And I will see you on Monday.